The chief medical officer at the Ministry of Health has indicated that the Ebola virus is not yet an immediate threat to the Caribbean. However, Dr. Merlin Frederick says that's no reason for the Caribbean to let down its guard. According to her, the Ministry of Health has embarked on a massive sensitization campaign on the deadly disease as it remains a cause for concern.
As indicated previously by the Caribbean Public Health Agency, or CARPHA, the risk of Ebola reaching the Caribbean is very low. However, we know that very low does not mean zero. So the possibility does exist. And this is why last year we embarked upon a massive sensitization drive for our healthcare workers, for our partners. We reinstituted our port health surveillance, and to date we have about 18 environmental health officers and port health nurses at various ports, including some of the seaports, providing the surveillance that we need there.
Targeted training, the chief medical officer says, will be made available for medical and fire personnel. She also says simulations will be staged in order to test the present systems already in place.
This year we'll be focusing on providing training to targeted groups, and these will be the medical officers and the fire officers who will be directly involved should we have a case. So we'll be providing targeted training to the persons who will be working in our various isolation areas, in the isolation center that we will be setting up on the compound of the new National Hospital. And we'll also be going through various activities or simulations to test our system.
The simulations, Dr. Frederick says, will commence at the Grosile Polyclinic within the next week or two. The intention, she says, is to simulate a situation in which a patient who has contracted Ebola walks into the facility. For the DBS News World, I am Alex Bousquet.